You know, monsoons are very unique to the subcontinent. We all celebrate the monsoons, but with the monsoons, there are lots of diseases which also spread, and every year it's almost the same story. This time around, we're going to talk about conjunctivitis or the pink flu alert. There have so far been 1,521 conjunctivitis cases pan-India. The doctors are witnessing around 100 cases every day in Delhi alone. Private care hospitals in Delhi reported 1,032 cases in both Delhi as well as NCR. Mumbai, the financial capital, has seen 20% spike in conjunctivitis cases. Chandigarh's GMSH16 reported 1,186 eye flu cases in a week. Now, spurt of eye flu cases have been reported in several parts of Agra. Flood hit Ambala reported 1,225 cases since, let's say, 13th of July. Ambala reported 19 conjunctivitis cases on Tuesday alone. Everybody, 1 in 10 at least, you see in offices, you see in marketplaces, you see in several other places, schools, children, either are coming with dark glasses or they are staying at home because this has now become a major irritant. So there are a lot of myths also around conjunctivitis. First of all, why is it that it only comes when it is raining? On your screens you can see a lot of people with umbrellas, those people waiting perhaps in an OPD of a hospital wanting to show to the doctor as to what is the way out. So let's get into this debate and figure out the reasons and how it can stop its spread. Dr. Anita Sethi, who is Director and Head of Ophthalmology, Fortis Hospital, Gurugram, is joining us on the debate, and Dr. Rahil Chaudhary, who's MD, AIIMS Hospitals, is also joining us. But before that, let's listen in to a voice about the disease.
Yes, we are seeing a few cases of Madras eye. Madras eye is also called as conjunctivitis. Conjunctivitis is one of the infection of the eye which is caused by either by a virus or by a bacteria. Adenovirus is the most common virus which is seen nowadays, and it is usually seen in the monsoon time, and people like children and old people usually have this kind of infection, and it is rampant among public nowadays because it spreads fastly either by the tears or by the spread of the virus. And there's nothing there to be worried, neither to be scared of. It gets healed in 7 to 10 days if no any treatment is taken, and if a course of antibiotic is taken, in 3 to 4 days the patient gets better.
There are of course myths around it. In 1971, after the India-Bangladesh war, apparently it was said, and I'm saying myths, I don't want to kind of label any country. They said some of the cases came from there. Also, it was for the longest time associated with the old name of Chennai, that is Madras. It was called a Madras eye. Again, I don't want to sit on judgment. I don't want to call a particular state or a country out saying you spread it. No way. But let's figure out what are the reasons. Dr. Rahil Chaudhary, MD of I7I Hospitals, has now joined us on the debate. Dr. Chaudhary, great to see you. Good to have you on
My
our
pleasure,
show.
and thank you for inviting me to the show.
Dr. Chaudhary, why is it that every time there are monsoons, and maybe, the years when we had COVID, maybe we didn't hear about it because we were all inside our homes, But what is the relation between conjunctivitis and monsoons?
Like you've rightly said, that usually the spurt of this conjunctivitis is around the monsoon season. Why around monsoon season? Because at this time the humidity is high, the environment is slightly warm, so it creates a favorable environment for these viruses to replicate and cause these infections. But this time, surprisingly, what we are seeing is that the cases which we routinely see otherwise, this time the cases are about tenfold more than otherwise what we see generally when this viral conjunctivitis happens during the monsoon time. And usually it is being attributed to the floods which have come in some areas of Delhi. So that is again a possibility that contaminants and viruses can replicate faster when you have contaminated water around you. And generally, this warm and humid climate is the source by which the infection can spread, and we see rise in number of cases in the hospital.
Yeah, so I want to ask you also, Dr. Chaudhary, that you say that you're seeing a lot many cases. Now the thing is that whenever we talk about more cases, like they say, हमारे ज़माने में तो इतना हार्ट अटैक हमने सुना ही नहीं था, लोग घी खाते थे, घूमते थे, यू आर स्माइलिंग, बट दैट्स व्हाट वन हैज़ हर्ड, हम तो अच्छा खाते थे, वी डिड नॉट ईट पोल्यूटेड kind of food, etc., etc. But the point also is that you doctors and the medical fraternity have always said, look, those days maybe they did not report it, now you are coming to us. Do you think the more cases are also because post COVID all of us have become very, very cognizant and conscious of the fact that let's go to a doctor, isko dikha do ab.
Yes. So these conjunctivitis were again an issue when COVID had come in. And this was a sequel of COVID, that we were seeing a lot of patients with conjunctivitis post COVID. Plus, after COVID, during that time, a lot of people were also indoors, so the infection was kind of controlled, because you see, this infection is also spreads when you are going into crowded places, when there are a lot of people around you. So that is again a source why this infection can spread. So now that people have started coming out, when the COVID is gone now after 2 years, so we see that there's an increase and rise of spurt in these cases.
Right. Dr. Chaudhary, I also want to ask you something, that COVID did one very good thing for all of us. It actually made us very conscious of certain facts, that look, you are not going to get COVID because of this, you are going to get COVID because of the breath, you have to wash your hands, you have to see that the spaces, the surfaces are clean, don't go out and maintain social distancing. But I'm going to tell you something, I have met people who said, and I'm laughing because I think you'll also smile when I tell you the reason, wearing dark glasses. And I said, what happened? He said, pata nahi, 2 दिन से आँख आई है. I said, अच्छा तो आप आए क्यों काम पे? So they said, नहीं, I am wearing dark glasses, this is fine, it's only when I look at you, आँखों से आँखें मिलाने से ही बढ़ता है. So I said, आँखों से आँखें मिलाने से इश्क होता है, conjunctivitis नहीं होता है, so I was laughing about it. Look at it, people still do not know that it is not because I'm looking at you and I have red eyes that the others will get it. Please explode these myths for the viewers as to how is this spread, Dr. Chaudhary.
See, it is very important and imperative to understand that this infection, it spreads something like COVID. So during COVID time, like we used to tell all our patients that avoid touching your nose and mouth, because usually these infections, these viral infections, they spread to a fomite route. What does that mean? That somebody has an infection in their eyes. Now suppose they touch their eyes with their fingers, and now they are touching some other surface, and then somebody, if that person is touching those surfaces and then touching his eyes, then the infection gets spread. Similarly, if somebody has eye flu and he touches his eyes and then he's shaking hands and maybe touching things around in the house, and all those other family members are touching those surfaces and they're touching their eyes, so the infection can spread. So the most important thing that we tell all our patients is that you should avoid touching your eyes. This is the most important step to be followed. Plus, also we recommend that at times you can wear 0 number glasses. So these glasses kind of become a barrier to your eyes. So suppose inadvertently your fingertips are going towards your eyes, so you have a barrier which takes care of that. But yes, this myth has to be cleared, that it does not spread by looking at other patients' eye who has viral conjunctivitis. So this is, I think, the most important myth that needs to be cleared, because most of the time people have these phobias that if we look at somebody's eyes, a red eye person, that infection can spread to their eyes just by the route of air. That does not happen.
Dr. Anita Sethi, who's Director and Head of Ophthalmology, Fortis Hospital, Gurugram, has also joined us. Dr. Sethi, lovely to have you. Dr. Sethi, I want to ask you, considering that you see a lot of other cases as well, there is a fear that people who have, let us say, cataract, or advanced stage of cataract, haven't yet got operated because, doctors say that cataract, let it be for some time, and then we'll operate, or they have glaucoma or autoimmune disease like VKH and, these kind of diseases. Are they more prone to conjunctivitis, or that's also a complete myth because there is paranoia? In our country, as you well know, cataract and glaucoma and also other kinds of eye diseases because of diabetes is high. So, I am asking you that are they more vulnerable, or that is not true?
No, thanks for having me here. No, that is not true at all. I think, as Dr. Rahil has already said, that this is a seasonal infection and is more likely to be spread in crowded places. So yes, if you look at it from this point, that those who have elderly people will come to a hospital, they may be more prone to pick up other infections, including eye flu and conjunctivitis. From that point of view, those who are older, diabetics, who are visiting the hospital for other reasons, they may be a little bit more prone. But really, it is spread in the crowded areas, the schools, the colleges, offices. So it is, again, spread by the secretions. So it's just most important that those who have the disease shouldn't touch their eyes. And in fact, the prevention is also to not touch your eyes and the frequent use of hand sanitizers. So other than maybe diabetics who are prone to more infections anyway, those who have dry eye, those who are contact lens wearers, they may be a little bit more prone to pick up any infection, including this. So the contact lens wearers, the patients of dry eye, they may need to be a little bit more careful they may be a little bit more prone.
Right. Dr. Chaudhary, what is the difference between pink flu? People are calling it also pink flu and, conjunctivitis. Are they the same kind of an ailment, or there is a difference?
Well, I haven't heard of pink flu before, but I think most probably there are different names of the same problem.
Right.
So, viral conjunctivitis is also known as eye flu. It's also called pink eye or red eye at times. And sometimes it is also referred to as aankh mein dukhni aana ya aankh aana. So, these are multiple names for the same problem. But you see, what is important to understand here is that there can be 100 reasons that the eyes can get red. Now, are you having viral conjunctivitis, or is it some other problem that the eyes have become red? That needs to be checked. Because usually what we are seeing nowadays is that when patients are having these red eyes, and now they are hearing so much about eye flu and news and other places. So generally patients, what they're doing is that they are visiting some local pharmacy or drugstore.
Hanji.
And they're usually asking the pharmacy guy that I've got eye flu, prescribe me some medicine. And 99% of the cases, the pharmacy guy is giving him an antibiotic and steroid combination, something like a moxifloxacin and dexamethasone combination. And this becomes a problem because in early stages of this disease, steroid drops are usually not recommended because steroids can increase the disease and cause more viral shedding and delay the healing process of the eye. So this is becoming a concern for us that people are self-medicating themselves and they are getting into bigger troubles. Suppose they don't do this and visit a doctor, then otherwise this problem can go away in about 10 to 15 days. It's a mild problem usually, and it is usually self-limiting.
Dr. Chaudhary, I will come to you about the duration later, but Dr. Sethi, let me bring you in here. Dr. Sethi, the other thing, I do not know whether it's paranoia or we are being extra careful, but for instance, my colleagues, a lot of them are also down, okay, with conjunctivitis. 4 of them have told me that they have had it when they were children. It would stay for 4 days. On the 5th day, there will be a bit of redness. On the 6th, it disappears. This time around, they say it's staying for a longer time. So, do you think that that is, I'll tell you why, because after COVID, we've all become kind of slightly scared, कि पता नहीं कौन सा variant है, पता नहीं कहाँ से आ गया, we're all very scared of this. So, please talk a bit about that to the viewers, about whether it stays for a fortnight, because someone I know and my colleague has been off work for almost 7 days now.
This time it is a little longer. In usual years, the conjunctivitis is 5 to 7 days. This time it is a little longer. And really, it is milder in children. So when your colleagues were children, they would have had the milder variant. And as we become adults, somehow we seem to get it a little bit more severely. We don't know which variant it is. And I mean, now, of course, people are working on trying to figure out. It's usually adenovirus at this time. And we don't know for sure, how much different it is from the previous years. But definitely this year, it is 7 to 10 days, it is lasting. And the important part to know is that it is infectious for as long as you're having watery eyes. So usually after 7 days, you might still be having a little discomfort, but the eyes will stop watering and it is then not infective and you could come back to work. But some patients, it is going on for 2 weeks. So it's a little difficult to say. Definitely children, it's milder. And in adults, it's a little longer. But it's important to know that this is not a severe eye disease. It is not going to cause any lasting complications in most of the patients. So you just have to take symptomatic relief, take the eye drops, and it is going to get better, maybe 7 days, maybe 10 days. The problem is when people over medicate or they don't see a doctor, and the few patients who might develop corneal complications, if they don't see a doctor, that can be a problem. So it is best to see a doctor, get prescribed, and you will be well in 7 to 10 days. It's not scary, and I don't think it's in any way related to COVID. So it is just the normal seasonal infection, maybe a little more severe this time, more patients, more infectious, and a little severe in just a very few number of patients.
Right, and even as Dr. Sethi spoke about more cases, let me also bring you up to speed for those who've just joined us on this broadcast. 1,521 conjunctivitis cases pan-India. Doctors are witnessing average 100 cases every day in Delhi. That's the statistic. And also private eye care hospitals in Delhi reported 1,032 cases both in Delhi as well as NCR. Mumbai has seen a surge of 20% spike in conjunctivitis cases, exactly what Dr. Sethi was saying. Chandigarh GMS at 16 reported 1,186 eye flu cases in a week. Spurt of eye flu cases reported in several parts of Agra, and flooded Ambala has also reported around 1,225 cases since 13th of July and reported 90 conjunctivitis cases on Tuesday alone. So that's pretty much the lay of the land, as it were, and I showed you those statistics only because Dr. Sethi was saying that how more cases are now coming to the fore. Let me go to Dr. Chaudhary. Dr. Chaudhary, I want to ask you something, is that I have seen a lot of cases at work, and even a lot of them have got it from their kids who went to school. They said my daughter or son had it and I caught it. But they are coming to work every day. It's not like they are taking a single day off. Is that proper? Because I panicked. I said, "Arey, aankh aayi hui, aap log kyun aaye ho?" Now you do understand that certain tasks or skills you have, like makeup men. I mean, we have to apply makeup when we are in television. So his hand goes all over. So I'm scared of that. But as journalist, if you're just typing on your own keyboard, or if if you're doing other functions like that, does it matter, or you think, Dr. Chaudhary, they should stay home for a couple of days, sir?
Yes, it does matter, and that is why usually we recommend adults who are having this infection to take off from their work for about 4 to 5 days. So the initial 4 to 5 days are the infective phases when the infection can spread from one person to another. So usually people going to offices, they will have other people around them. And even if you take all the precautions, you cannot eliminate 100% the risk of spread of infections. So usually for adults, we recommend that you start taking treatment. And in the initial phases of this problem, you also could have a lot of watering, lot of irritation, itching, and maybe photophobia, sensitivity to light. So all of those things can also be taken care of if you take 3-4 days off be at home for some time, do your symptomatic treatments, do the treatment that doctor has prescribed you, and let the infectious phase of the disease go away, and then you're good to join back all your routines. And especially with children who are school going children, for them the recommendation is that you should take about 2 weeks off, because children are usually careless about these things. They would not wear the dark goggles, they would not stop touching their eyes, and usually they are fidgety about these things. And especially the eye being red, they can also be bullied by some of the other children. So for children, it is recommended that you should take about 2 weeks off from your routine, off from school, and for adults, 5 days is good to go.
Right. Dr. Sethi, the thing is that Dr. Rahil Chaudhary spoke about, medication and steroids being given. He said it is not, advisable at all. But you know what? Again, this is again a rumor. Oh, there are no medicines for conjunctivitis in Delhi and NCR. सब कुछ ख़त्म हो गए हैं, आप लोग खरीद के रख लो, ज़रूरत हो सकती है. You know that panic which is created amongst people as if that's the end of everything. So I want to ask you, A, is it important for someone who's got this infection to immediately see a doctor, or you think, because a lot of them say that we can't go, I mean our timings are not suitable, they are doing video calls, or actually video calls are also okay, they are doing phone calls, they are going to pharmacists and saying dawai likh do. Tell me how important it is to visit a certified doctor who can sit you down and tell you the entire process.
I think it's very important to see the doctor, because there are chances in some cases where it's very severe and there can be corneal involvement. So yes, I mean, if it's absolutely not possible, then at least a video call or a video consult. But I think it's important to see the doctor and be prescribed the correct medication. The medication is very simple eye drops, and there is no question of it finishing up. So that is really, I think, just unnecessary panic. We are only prescribing lubricating drops and antibiotics, simple antibiotic drops. In a very few subset of severe cases, we may need to give some anti-inflammatory, some dilute steroids, but that, unless we see the patient, we just can't advise that. So yes, I do believe that even though there is a risk of your spreading the infection, but you should still see the doctor to confirm the diagnosis, because as Dr. Rahil said, there are other cases of red eye and we don't want to be missing out on something else. So we must confirm the diagnosis, start the treatment, and explain to the patient how the disease is going to spread and how it is going to stop, and so that they're just well educated and aware, and we prevent the panic, and we prevent the spread like that.
Sure. Now, Dr. Rahil Chaudhary, I want you to tell the viewers as to how do you protect yourself from a patient who comes visiting you and has conjunctivitis. What do you have to do around a patient or around someone who has, if my colleague has conjunctivitis, what I am doing is I'm paranoid, so I kind of keep hand sanitizing, and I, because I'm scared. I mean, I feel it's a profession where I have to be on camera, so I can't possibly have an eye infection. No one should have it, God forbid. But tell me, how do you, Dr. Rahil Chaudhary, what would you say are this 1, 2, 3, 4 pointers to protect yourself from not getting the infection?
So, let us take an example that there are some eye flu people around you, and how do you protect yourself, and what does the eye flu patient has to do so that the disease is treated faster and he gets relief from that. So number one, the first thing that we tell everybody is don't touch your eyes, because you have to understand that this infection spreads to fomites, and those viral infections can be on any surface, on the table, on the door handles, on the bathroom handles. So avoid touching your eyes, because there's so many times the infection can be on your fingertips and that can be spread to your eyes. Number two, you can wear a zero powered glasses. So this is a barrier, so that in case accidentally your fingertips are going towards your eyes, so you have something to stop them. Number three, all the surfaces preferably should be sanitized with sodium hypochlorite. So it is readily available. So that also gives you an added cover. Also, sometimes what I see people is that they see people around them having eye flu. So, as a preventive measure, they start putting antibiotic drops in their eyes. So,
Yes.
again, we have to understand that this problem is a virus infection, it's a viral problem. And antibiotic drops are only given to prevent secondary infections, because once you have virus on your eyes become more susceptible to catching secondary infections. So putting antibiotic drops just like that would not help you. Rather, it would cause more harm, because then your body can become resistant to those antibiotic molecules. And then when you actually need them, the medicine doesn't work. Plus, also, I see a lot of time people they keep washing their eyes with cold water. Like you were displaying some images here also when we were talking. So
Yeah.
there were a lot of people who were just splashing water onto their eyes.
Right.
And somewhere people have heard that eye hygiene is very important in eye flu. So they keep washing, thinking that the eyes would stay clean. So that is a very bad habit, because you see what happens is that once you have this eye flu on your eyes, your the immune status of your eye is low, and you are at a risk of catching other infections. And usually the water supply in our country can be contaminated at times, and that infection can then go to your eyes. So washing your eyes with tap water, absolutely not recommended. Plus, also, I see that when we tell patients to keep eye hygiene, usually what they're doing is that they're using their handkerchief or rumal or maybe a
Yeah.
piece of cloth and they keep cleaning their eyes, and then they keep that cloth piece with them, or the handkerchief with them. And then they're using it for one eye, then they're using it for other eye. So in these cases, the infection can spread from one eye to other eye. So for that, we usually recommend that you should use disposable tissue paper. So you clean your eyes, and then the tissue paper has to be discarded. It doesn't have to be kept with you. And then you take a new tissue paper, clean your eyes with that, and then discard it.
Right.
So these precautions are important, and you can just pass out this phase.
Right. Dr. Sethi, you know what Dr. Rahil Chaudhary was saying right now, and I want you to elaborate on this. In conjunctivitis, the eyes stick to each other. When suppose you've slept off in the morning, वो आँखें चिपकी हुई होती हैं. So I guess for that people actually splash water, you know, and also I think most of us wash our faces in the morning. I mean, you know, so particularly when the eyes are stuck, I saw someone recently said, my eyelid is stuck to my eye. How do I open my eye? So he I mean, of course, you get tissues, particularly for the eyes, which you nichod ke, you know, you can, they are very expensive, those eye tissues that you get, particularly for cataract patients after, you know, the operation. So I'm asking you this, that what do you do then? I mean, how do you deal with sticky eyes, ma'am? How do you open your eyes?
I think Dr. Rahil has really described all the points. I would really like to highlight that the use of cloths or hankies is really to be avoided, because the virus will stay in those cloth and those hankies. So yes, tissues. Now in the morning, coming to your question, you know, boiled water and cotton, you know, gharwala boiled water and cotton, and maybe with a pinch of you know, meetha soda, baking soda, you know, you can just use that, and closed eyes, you just gently clean the eyes so that the sticky whatever has got stuck just becomes liquefied, and then you can just wipe it away. So tissues don't work as well for that, because the tissue scrapes the eyelid. So the morning problem is best solved with if you do have boiled water, that's really good, or just water and cotton with the closed eye. I think the splashing of the open eye is what can give rise to other infections. But to unstick the eye, you can use the boiled water or just some clean water and cotton, and very gently dissolve the you know, the stickiness or the, you know, the crusts that are there, and they will gently flow away. You don't have to rub it very hard. Don't, you know, ragdo it, because you will cause some injury. Just gently wipe it away. It will get wiped. And a pinch of baking soda or a pinch of boric powder is a little antiseptic, as are some of the wipes which have tea tree oil. And they can be, those who have a severe infection, the secretion cause the whole eyelid skin to become very dry, very uncomfortable. Sometimes I've seen people get cracks in their, eyelid skin, extremely painful. In those cases, you might need to use the tea tree oil or maybe a little bit of coconut oil away from the eyes just to make the eyelid skin a little better.